So my name's Jenny Thomas. I'm actually a student midwife, second year now, but my previous history was patient experience. I spent 10 years in patient experience, and I was able to help start off this project. And I'm still very privileged to be able to work part-time with the Trust now. So they asked me to come and present today, which is absolutely amazing because I've always loved PENNA. Lorraine Soul is our head of nursing for outpatient services, and she put this presentation together, but she couldn't be here, unfortunately. So just as a bit of background, we're a really large trust. We're the only trust in Cornwall, and we have 3 main hospital sites and lots and lots and lots of outpatient appointments delivered at those sites and at peripheral sites as well. And historically, the friends and family test has been something that we haven't done very well with in outpatients. I think a big problem was that it wasn't mandatory for us to collect response rate data for outpatients, so a lot of the trust resources were put elsewhere. And also we used the kind of paper surveys, and with having lots of peripheral clinics and lots of sites to administer, it just gave us a really poor response rate. And also it didn't tell us what we wanted to know about outpatient services as well. Following the CQC report in 2018, we really wanted to improve the collection of data because there were things that the CQC picked up on and that we knew we wanted to change, but we wanted to hear more from our patients about what they wanted us to change and what was important to them. So that was a real catalyst behind this transformation. Thank you, next slide. So in 2018-19, this was the picture. So this was our baseline data that we were working from. We had a really large number of outpatient appointments, but a really low comparable number of surveys received, giving us a response rate of 1.6%, which, as I said, it wasn't something that we were prioritising, getting a response rate in outpatients. And also the engagement from our patients and our staff wasn't there because the survey we were asking our outpatient patients to complete wasn't meaningful. It wasn't meaningful to the staff and it wasn't meaningful to the patients. It was just our standard FFT survey. Thank you. Next slide. So what we did was we got together. Lorraine Soul, who is our head of nursing for outpatients, was the real driver behind this. She's really passionate about finding out from our patients how we can improve the services. So yes, we looked at what the CQC said. The CQC said we weren't responsive enough, and there were lots of things they picked up around environment and waiting times. But she said, okay, we want to respond to this CQC, but we also want to find out what our patients say. So we had a big group of all of us getting together, and we looked at our current outpatients, friends and family test. We looked at doing a bespoke survey for outpatients, but we thought, why not just tie them both together? It would give staff the opportunity to use one survey that's meaningful to them to get the feedback from patients. And we looked at how we can improve the engagement as well. So make more visible to patients. We want your feedback. We'd love to hear from you. But also with staff as well, as I said, the engagement, if you're a member of staff and you're busy enough as it is, if you're not seeing the results of feedback and the improvements that are being made and what patients are saying, negative and positive, they're mainly positive, and as a member of staff you want to shout about that in your department, but if you're not getting that side of things, then you're not going to be engaged enough to actually ask the patients for the feedback. So speaking to the departments and putting posters up and really launching this survey was a massive driver into actually getting the meaningful information that we wanted. Thank you. Next slide. So these were just some of the things we wanted to know. We were using the standard friends and family test question, and we were using some compassionate care questions on the back, which was they came about as a result of After Francis, and they were fantastic for our inpatient services, but we wanted something more bespoke. We wanted to really find out specific to outpatients what their experience is like. So things that are really important to them, like, could you find the department? Did staff introduce themselves? Was your appointment on time? If it wasn't, did we keep you informed of delays? Because we know that's really important to patient experience. And did you have enough time in your appointment as well? Thank you. Next slide. So we have some initial findings, and this is just to give you a very brief example of the sort of thing we can see now. So Lorraine, her team, specific clinic can now see on our system that we use for collecting data. They can see, a patient saying that their appointment was on time. So, for example, this one, most of them were yes, definitely, or yes to some extent. But actually, if they weren't on time, a big proportion of patients weren't being kept updated. So for Lorraine and the team, that was a quick win. That was something that she could really engage the teams in and really start to improve for patients. And not only were we collecting more meaningful information to do with outpatients, we were seeing a massive rise in the volumes of surveys we were getting back. So even though we were still using paper, which is something that I'll come on to in a minute, even though we were still using paper, the volume of surveys just from that relaunch and that engagement and that really talking to staff and launching it with our patients, the numbers, as you can see, rocketed in November. And even in December, which is a quiet month, well, not quiet, but less working days, less outpatients appointments, there was still more in December than we'd ever seen, and more surveys than we'd ever seen ever in outpatients in January. And then, of course, COVID started happening and they've come back down again, but that initial rise is really, really promising. And just to briefly touch on this, it's something that I'm sure you've all heard of. Ward accreditation is something that we've used in the trust and it's been really successful. And Lorraine's really keen to start outpatient accreditation as well. As it says there, platform for continuous improvement in patient experience, which is absolutely fundamental. And the plan was to begin outpatient accreditation in March, but unfortunately that's been postponed due to the pandemic. If we can go on to the next slide, please. And that's going to look at patient experience as something that's really important, along with all the other standards that we look at as part of the accreditation. The patient experience, so are we displaying posters? Are we telling patients what we're doing with their feedback, as well as actively encouraging their feedback? And are we telling staff as well? Are we enabling staff to access their feedback and see what we're doing with it as well? And another initial good finding from this project was that in 2018, the CQC said that the outpatient services required improvement. And then a year later, in December 2019, so just after the relaunch of the new Outpatients, Friends and Family test, it said that the service was good, and it said that it made it easy for people to give feedback, which was the whole point of this project, which is absolutely brilliant. And then looking to the future. So as I said earlier, we're still using the paper FFT forms, and the plan was always, even before COVID, the plan was always to follow in the footsteps of our emergency department and introduce SMS texting, because what we've found in ED is that patients who have been able to go home and then give their feedback online, we're getting real-time, honest, really good qualitative feedback, and because they're not having to hang around the department to fill out paper form, we're getting more of it as well, which is absolutely brilliant. So we've got stick. There's work going on looking at an app to give the feedback, and other collection methods like iPad stations in the waiting areas and pop-up prompts when people log onto the Wi-Fi network as well. So lots of future ideas for how we can take this forward. And then I couldn't leave you without putting a COVID-19 slide in there. So lots of things have happened to outpatients as a result of COVID-19. So video clinics, as you can see, going from 2 in January to nearly 1,400 in June. There's been a massive learning curve for staff and patients, and telephone clinics as well. So what we've done is adapted the way that patients give feedback to that as well. So after a video consultation, patients will have an automated link at the end to give us their feedback via Friends and Family test. And the same with their telephone consultation as well. And what's going on currently is that we're asking them about the actual video consultation or the telephone consultation. So lots of technical and practical questions about getting that bit right first. So are we getting this video consultation right for you? Is it easy to access? Is it something that we can sustain? After we've initially embedded that, if you like, the plan will be to use the questions developed as part of this project, the real meaningful outpatient experience questions, and roll that out across all the sort of mediums that we're using for appointments and surveys. And I think that's it. Thank you very much.